This is OHSU, shaped by leaders, pioneers, and those brave enough to take that first step. We carry the torch and shine a light on what is possible. We are a collaboration of disciplines, listening to one another, learning from each other. The OHSU Internal Medicine Residency Program is more than an opportunity to gain experience. It's your time to serve with a community of trailblazers and groundbreakers.
When you're done with your education, you will be a great internist. That's not the issue. The issue is we want you to take it a little further than that. We want you to go into whatever environment you're going to work in, you know, whether that's a clinic, whether that's a hospital, whether that's something at a governmental level, whatever it is, that you take responsibility for making that place better than it was before. And so that's what we mean by physician leadership, that in the end, that's what will drive you to be your very best in whatever environment you end up being in. We have a real emphasis on the social determinants of health. So why are people where they are? What is the reason that they're in this position? Because it's not the disease itself that defines people. It's their life circumstances, you know, how they grew up, what did they have, what were they afforded, not afforded. I mean, I think an emphasis that we carry in the program, actually throughout, whether that's in the inpatient side or the outpatient side, is really focusing on that. So we have rotations where we're embedded in the community. One particular one is a federally qualified health center called Central City Concern. You know, their mission is to end homelessness, but they don't do it just from a healthcare perspective. They do it from every aspect of medicine you can think of. And so we have our residents in that environment for a month, learning really that it's not just about can you treat someone's diabetes. That we will be able to teach you. What you really need to be learning is how do I ask the right questions, how to care for this patient beyond just can I give you a medication or can I diagnose a condition that you have.
In medical school, I learned the disease processes, but I think the residency program really taught me to be a thoughtful and caring physician from top to bottom. I think it starts with the humanity. It's hard to provide that same level of care to other patients until you have found that in yourself. And so I think that's something that is just instilled in the culture of the program. Everybody will support you professionally, and I think that's a given, especially at most places. But I think one of the things that's most unique, and particular to my situation, was that, you know, unfortunately, during my training, you know, I found out that my dad was diagnosed with lung cancer, and a year later he passed away, and it all kind of happened out of the blue. I mean, looking back, I couldn't have gone through that experience anywhere else. You know, the support that I got from our program, you know, my co-residents was tremendous. To this day, I'm still grateful for that, and I think that's why I have such fond memories of my time here, despite all the tragedies that happened. So I was well supported as a person, and I think that that's a unique thing to our program here. You know, they still helped me get to where I am today, so I'm very grateful for that.
It's individuals here that really work towards that team dynamic and are really there for you, whether that's trying to learn a new topic from an educational perspective, or if it's something that you're going through in your personal life. My co-residents have become my family here, my de facto family. With COVID, it's been a little harder to get together in larger groups, but we still see one another one-on-one or see each other in the hospital. And I know I can reach out to any one of my co-residents at like 3 a.m. and say, hey, I need help, or something's going on, or anything that might happen. And I know that my co-residents are here for me.
I'm a career changer. I'm a little bit older in my life. And I kind of always had this inclination that I wanted to be a primary care doctor. As an athlete, you're kind of always thinking on the horizon, like, okay, when I hit, you know, mid-30s or something, what is my next career going to be? I chose OHSU for a number of reasons. One, I loved the program. I actually rotated here as a fourth-year medical student in the geriatric department. So I kind of got like a view from the ground, what the hospital culture was like, how the administration functioned, whether the residents were happy, and kind of that behind the scenes view just gave me a really wonderful impression of OHSU.
I'm finding out more and more every day how important mentorship is in every aspect of your life, you know, whether it be personal things or professional. And for me, you know, the program set me up with Dr. Hendrickson, probably one of my biggest mentors. I was very fortunate to get to work with him in clinic for 2 years straight, and he provided me so much mentorship, you know, professionally, and helped me get into fellowship, and not just that, but just kind of understand what I was getting into, and you know, get a realistic understanding of what a career in cardiology or electrophysiology was like. It was paramount, I think, being able to have that mentorship.
I'm interested in going into hematology oncology, and so we have an incredible cancer center here, the Knight Cancer Institute, and with that comes world-class researchers and access to mentors. So the ability for me to just email someone and say, hey, I'm interested in the same things you are, do you think we can link up? And finding that mentors are responsive, are excited to have us on board, was an incredible experience. And so kind of that was what drew me initially to OHSU.
Not to say we didn't work long hours. There were some very long weeks, but that is also interspersed with the clinic weeks and then kind of other less rigorous rotations. And so it really is a good mix. I'm married, I have a family, but I'm also just a person who enjoys doing things outside of residency. And I felt like this program balanced very well the academic rigors, the learning that we need to have before, you know, pursuing a career in medicine, and then also that work-life balance.
Learn about the people that you care for day in and day out. Again, they are not the sum of their disease. They are some of a lifetime. And so we're looking for people who care about that, you know, who can show their humanity. And it's not just in what you say, it's in what you do. You have to do more than just say it's enough to be a doctor. It's not enough to be a doctor. You have to take what you know. You have to then apply that even beyond what your profession asks you to do. You know, we've had our residents involved in the Black Lives Matter movement. We have done a lot of different volunteer activities. In fact, we set up usually 3 to 4 of these activities a year. Again, with the emphasis that it isn't just in medical school that you volunteer and then it just stops. It's not just that you do this in residency and you stop. You should be doing this your entire career, giving back. But I also think that's not just a doctor thing. That's a human thing. You know, the more that we give back in other places, the better we make this place.
At some point, it's about the why you do what you do, as much as the how. We do it because we are bold. We do it because someone needs to make the difference, and we know we can make the difference because we already have. We welcome the curious, inspired, and those willing to be bold. This is OHSU and the OHSU Internal Medicine Residency Program.